pre-surgery, the amount of people that were around you. You're meeting your anesthesiologist and you're meeting the vascular surgeon, and each one has their own partner that they're working with. And it was remarkable the amount of people that were there. I thought they were going to build a city.
It was really important.
It is obviously our job to make sure that you will come through the surgery safely and you will not hopefully have any difficulties. And I'm not referring to surgical problems, I'm referring to medical issues. There is going to be an appropriate amount of test ahead of time.
To ask all the questions you could think to ask, and to allow, in my case, my wife being my primary caregiver after the fact, to really be a significant part of that, because she was going to really take on a lot of that responsibility.
Getting poked and prodded and getting blood drawn, I was ready. I was ready.
We're gonna get some blood work on you. We're gonna get an EKG on you. We're gonna listen to your heart. We're gonna listen to your lungs. And we're gonna discuss with you that this is a surgical procedure where we will put you to sleep.
It's really interesting when an anesthesiologist has surgery, because all of a sudden you're on the other side. And I think you, in fact, learn something from that experience. You don't really appreciate how frightened people are going into that operating room. They don't really know what to expect.
We will put a tube down your throat. A machine will be working for you during that time. An anesthesiologist will be monitoring you during that time, and make sure that they understand that not only are there risks and complications associated with the said procedure, but there's also risks and complications associated with just putting you to sleep. And again, that is our job collectively as a team to make sure not only the treatment is correct as far as surgery, but the patient is safe to proceed with the operation.
The surgery center is all bustling. They're all in there waiting and ready to go. I got in my scrubs and they got me all ready for the surgery. I was strapped down to the cold table and everyone was really nice. The anesthesiologist came in with some jokes, and I remember I asked him how he stops the medicine going in. He said, I stopped putting quarters in the meter. And I remember counting, I think maybe to 10, 9, 8, and then I woke up and that was it.
You go into the holding area and they start your IV and then they give you a little something, and that really, it's wonderful stuff. It's called Versed. And at that point, you just don't really care very much. You know, you're relaxed and let's go. They wheel you into the operating room and that's it. That's the last thing you remember. The next thing you remember is waking up in recovery.